Hello and welcome to True Pathfinder, your portal to health and truth. And in this video, which is the first one in a two-part series, we're gonna have an in-depth look at a true all-rounder of non-invasive holistic therapy, namely galvanic therapy. We're gonna explore together how you can use it for prevention, to boost your performance, for wellness purposes, for treating many health conditions, cosmetic applications, and many more. So, let's see how it works, why it is so effective, give you some practical tips, and also look at some real-life examples and how you can treat different conditions with this type of therapy device. Without body electricity, you wouldn't be able to listen to what I have to say in this presentation. You could not understand my language and the content I'm disclosing, and it wouldn't be because your computer wouldn't work, it's because your brain and your whole body wouldn't work. Everything we do is controlled and enabled by electrical signals that run through our bodies. Everything is made up of atoms, and atoms are made up of electrically charged particles such as protons, neutrons, and electrons. Protons have a positive charge, neutrons are neutral, and electrons have a negative charge. When these charges are out of balance, an atom becomes either a positive or a negatively charged ion. The flow of negatively charged electrons is what we call electricity, and since our bodies have trillions of atoms in them, we permanently generate electricity. When we talk about a nervous system sending signals to the brain, the neuronal synapses firing, or the brain telling our hands to contract around a door handle, it is body electricity that carries the messages between point A and point B. It's like a digital cable signal that delivers law and order throughout our bodies. But in our bodies, the electrons are not flowing along a wire. What they do instead is they jump. The electrical charges jump from one cell to the next until it reaches its destination. Since everything relies on these electrical signals, a breakdown in our body's electrical system becomes a real survival problem. For example, when you get an electric shock, it interrupts the regular operation of the system. It's like a power surge, and the electrical processes become fried, so to speak. The heart, as a node, misfiring causes heart palpitations or arrhythmia, for example, a lack of blood flow to the heart also, which causes other parts of the heart to send out wrong impulses. If the heart is constantly being told to contract, it never gets into full contraction, and as a result it cannot get enough blood to the rest of the body, and that leads to oxygen deprivation and a possible heart attack or stroke. With so much electricity, you may believe that the body is a great power source. Well, our human body can only generate very subtle currents between 10 and 100 millivolts at 0.1 to 0.5 milliamperes. So the clue, therefore, of any type of electrical therapy is to get in resonance with these electrical signals and repolarize the sick cells which have lost their polarity. Life energy, also known as Qi or prana, will freely and continuously flow throughout our entire body, and only when this is possible, because the system is undisturbed, you are healthy. And ancient people already discovered that diseases come from energy blockages. The human electrical energy is generated by biochemical processes that are triggered and controlled by neuronal cells. Billions of nerve impulses travel throughout our brain and our nervous system. A nerve impulse is an electric wave that passes from one end of a nerve cell to another. And neurons, so the nerve cells, are the basic unit of our nervous system and are responsible for sending, receiving, and managing information from all body parts. Our body is a complex and carefully balanced superhighway of cells, tissues, and fluids that direct an incredibly high number of electrical impulses every millisecond. And this is only possible in a homeostatic environment when the electricity is well conducted to carry the signals to their intended destinations. The key to maintaining this conductive superhighway lies within the electrolytes household. Electrolytes regulate the nerves and the muscles' functions, the body's hydration, the blood pH value, the blood pressure, and the repair of damaged tissues. And there are various mechanisms in our body that keep the concentrations of different electrolytes under strict control. What does all of this have to do with galvanic therapy, I hear you ask? Well, in order to answer this question, we need to understand what galvanic currents are. A galvanic element, such as a battery, generates galvanic current, which is usually in the range of 40 to 150 milliamperes. And this type of galvanic current flows continuously from the positive to the negative pole. And galvanic current, as you can see also from the picture here on the top right, is very different from other types of current, such as AC current that you get from your power grid, or variable currents and pulsating currents. What you need to understand is most devices that you get on the market today that use some type of energy therapy method, such as TENS devices or zapper devices, they all use interference currents. And this, they tease and irritate your cells. Galvanic currents, instead, are free of these frequencies and pulses. It's the red line, it's a direct current, and it has a totally different impact on your body. Galvanic currents are applied via two electrodes to our bodies. The positive ions move towards the negative electrode, so the cathode, and the negative ions move towards the positive electrode, also known as the anode. And when we apply these galvanic currents, there is an instant flow of ions that is generated that moves through our cellular membranes. And this type of galvanic currents harmonize and stimulate all metabolic processes. They correct the cellular membrane potential, they energize your body, they balance you, while on the other hand, all the other types of currents provoke the cells, they irritate them. Each of the 100 trillion cells in our body works like a small battery, so a galvanic element with about 70 to 90 millivolts, with the cell nucleus being positively charged and the cell plasma being negatively charged. The cellular membrane is an osmotic dielectric that enables an exchange of positively or negatively charged ions. And the millions of repeated ion movements are recorded in our brain and after a while become command centers for our lifestyle. And this can lead to epigenetically determined health conditions. The sick cells lose more and more electrical charge. The membrane potential falls to 10 millivolts or can go even lower. And this means that you are in a critical situation and you can be even very close to death. And only galvanic currents can help you regenerate and save your life quickly. Whichever condition you might suffer from, the treatment must always, therefore, start with galvanic therapy. Only with galvanic therapy, chronic and acute conditions will become rapidly a thing of the past. Why do I say that galvanic therapy is a true all-rounder? Well, because it can positively impact all aspects of your health and well-being. It's great for fitness applications, for faster rehabilitation, for physiotherapy, to boost your performance, for relieving your stress, relaxation and regeneration, for therapy of many chronic and acute conditions, for cosmetology, for facials, for having a better skin complexion, for lifting without surgery, for deep detox and cleansing. It's fast acting, it's risk-free, there are no side effects, it's soft and natural, non-invasive, it repolarizes your cells, it replenishes your energy, it corrects the cell membrane potential, which is very important, as we have touched upon, for any type of health condition to heal it. It's great for cancer, and we're gonna look in depth at cancer in the second part of this series. So if you're not subscribed already, please subscribe now so you don't miss out on it. What can it do for you? Well, there is a whole range of things such as detoxification. It helps with faster wound healing and tissue repair. It activates your autoregulative processes. It supports neuronal activity. It helps with blood and cell building, stimulates your hormonal processes as well as all metabolic processes, improves the capillary microcirculation, harmonizes your body, balances the autonomous nervous system and the central nervous system for better cellular communication. It removes energy blockages. It optimizes the electrical body, regresses inflammations, helps with infections, and is also antimicrobial. It energizes and regenerates your whole body, empowers your body's self-healing potential, regulates your metabolism, improves your blood and lymph circulation, mobilizes toxic deposits, stimulates endocrine activity, opens up your chi and prana energy blockages, and balances your meridians for a better energy flow. It balances also the electrolytes, activates the nerve synapses and neuronal cell regeneration, improves the quality of the skin, and the list goes on and on. We have tested many galvanic therapy devices and have selected two that we really love, which are available at vibrantbody.net, link in the description box below for you. And those two devices have different designs, as you can see, and different parameters, and they can be used for health applications, cosmetological ones, as well as fitness applications. As we have explained already, galvanic current flows always from the plus pole to the minus pole, so from the red electrode to the black electrode, usually from the top towards the bottom and from the left side towards the right side of your body. In very specific therapy cases, this flow can also be inversed. When you use this type of device, the electrodes must be always placed on cloths that are slightly wetted with warm water to assure the best conductivity and buffer skin dryness. You can perform galvanic therapy while sitting, standing, or lying down, doesn't matter. It is recommended that you repeat this type of therapy daily, each time for about 1 to 3 hours, with an intensity of the current of 0.1 to 2 milliamperes, depending on what you're doing, your case scenario. It's best to divert a galvanic current at the feet. For persons, for example, with varicose veins, it is recommended to do it through the tailbone. In pain therapy, the painful area gets the red electrode as it is calming, and the feet or the tailbone the black electrode. Switching on and off the device must be done slowly, in about 1 to 5 minutes. For infections with the galvanic therapy, it is recommended to also take the homeopathic D12 ferrum phosphoricum to activate the blood for better results. And of course, galvanic therapy can be and should be performed until all complaints and symptoms have disappeared. It is not recommended to treat with galvanic therapy acute cases where there are implants and pacemakers. And you should always start your galvanic therapy sessions with a general therapy to stimulate, harmonize, and regulate the whole body. As mentioned, the effects of galvanic therapy span from wellness, stress relief, performance boost, acute cases, to multiple chronic conditions, and also efficient prevention and health maintenance. As we all know, we are under permanent stress nowadays due to our lifestyles or lack of movement, sitting too much in front of a computer. We are additionally burdened by electrosmog from the Wi-Fi devices and network, the 5Gs and 4Gs, all these microwave networks for our communication. We are also under permanent mental and emotional stress because of our modern lifestyle and the lack of social balance. And under these conditions, the blood circulation, the lymphatic, and stem and ion exchange processes can easily become disturbed, and as a result, you develop all types of health conditions. You also feel tired and depressed, and because you suffer from an unbalanced metabolism. And only galvanic therapy can help you regulate and control these multiple stresses and activate your body's autoregulation potential efficiently. Applying galvanic therapy, missing ATP energy can be reactivated and replenished within minutes, supporting your well-being and your health thereby. And as a result, you can live again pain-free, you can regress inflammations, you can better coordinate your body functions through your autonomous and central nervous system, boost your physical and intellectual performances, and live in a stress-free oasis. Galvanic currents between 0.1 and 0.75 milliamperes stimulate ATP production up to 500 times. So while you work, you can be healing at the same time. Injured and inflamed sick tissue, such as tumors have, is always of a lower resistivity of 200 to 800 ohms compared with healthy tissue that is at more than 2,500 ohms. And this means that galvanic currents will preferentially flush the unhealthy tissue with the immediate result of reducing pain and increasing their cellular energy. So you will become healthy. Cellular nourishment and waste excretion are regulated by the cellular membrane potential that is controlled by the different electrolytes, so the ions, and the ions exchange means a healthy autoregulation and as a result a healthy life. And the force behind this permanent flow of ions is your membrane potential. With subtle galvanic currents, you can correct these ion exchange processes. And health, harmony, and a new life quality are the result. Regularly applying galvanic therapy is the best non-invasive prevention method known to mankind. How can we apply galvanic therapy? Well, these galvanic microcurrents can be applied to our human bodies in 3 different directions, or 3 different manners. In an ascending manner, descending, and in a so-called perfusion. In the ascending situation, we place the red electrode, so the plus pole, at our feet, and the currents move towards our neck or head, where we have placed the minus, so the black electrode. And when the currents flow in this way, they generate a stimulating effect on our bodies. In a descending situation, the currents start from the head, where we have placed the red, so the plus pole, and they move towards the feet, where we have placed the black, so the minus pole electrode. And this has a calming, sedating effect on our body. When we use the perfusion method, we apply this type of current to a specific zone of our body to treat a specific health problem in that zone. And in this case, we place the plus and the minus electrode on opposite body zones, such as the chest zone and the thorax back, the left limb and the right limb, etc., etc. And the advantage of this treatment modality is that we can flush a large body zone, a specific body zone, with these beneficial galvanic currents. Some examples of such perfusions: left hand to the right hand, or left foot to the right foot, back to the breast, your lower back to the belly. Also choose whether you use the ascending or the descending currents for stimulation or relaxation and to calm. For local organ therapy, for example for liver therapy, we place an electrode on the abdominal side underneath our rib cage and the other electrode on the kidney zone on our lower back. You must pay attention also when you use this type of therapy to the so-called polarization effect. When we apply galvanic currents above 0.5 milliamperes to the same skin zone, the skin becomes an insulator and the currents cannot penetrate the body any longer. With a current at 5 milliamperes, the skin insulates after 3 minutes already. Currents below 0.1 milliamperes cannot trigger this effect. Also, using pulses or inversing the poles will significantly shorten the time until the skin insulates. So when we invert the poles, we must first increase the currents to depolarize the skin. And do not worry, when you get your galvanic therapy device from vibranbody.net, we will assist you in how to use it and answer all of your questions. And our devices come with a great manual with loads of pictures that explain exactly what you have to do. And here you can see some examples of the illustrations that come with your galvanic therapy device from vibranbody.net. Where exactly you have to place the electrodes is clearly indicated in these images, as you see, and but it is also shown how you can use it for fitness purposes, for wellness and relaxation purposes, to boost your performance, and for different health conditions. So it is really not complicated at all. The IONO-TRANS, which is the name of the galvanic therapy device that we offer you at vibranbody.net, can also be used for cosmetology. It naturally lifts and tightens the skin on your eyebrows, chin, neck, and cleavage areas. This procedure also stimulates the production of new collagen by delivering focused electrotherapy and differentiants. It's easy, it's safe, it's non-invasive. It has special anti-cellulitis modes, or it's a special mode for lipolysis, for lymph drainage, for tissue toning, IONTOPHORESIS, and many, many more cosmetic applications. What is IONTOPHORESIS? Well, that's when we use the galvanic current to carry our remedies faster to the cells and improve thereby their absorption and penetration. And as you can see in the manual with our devices, you get a whole list of drugs and solutions such as zinc oxide. It explains also the main indications, the rationale, and how to use and set up your galvanic therapy device for this particular type of drug. Before you start a targeted galvanic therapy for a certain health condition, it is recommended that you prepare your body first for this kind of treatment. And this is also easily done. What do you do? In the first week, you work on the general condition of your body. So for 20 to 60 minutes, you take the plus pole electrode in your left hand and the minus pole will be placed on your left foot. You use 0.1 to 0.2 milliamperes and you increase slowly the treatment time and the current intensity. In the second week, we want to activate, detoxify, consolidate and energize the body. For that, again, daily for 20 to 60 minutes, we take the red electrode, so the plus pole, in our right hand, and the black electrode is placed under the right foot. We use 0.1 to 0.5 milliamperes, and again we increase slowly the time of the session and the current intensity. In the third week, we want to regulate, energize and regenerate our bodies. Again, daily for 20 to 60 minutes, we take the plus pole in our left hand and we place the black electrode under our left foot and use 0.2 to 0.4 milliamperes. Week 4 is for basic auto-regulation. Daily, 20 to 60 minutes, we take the plus pole electrode in our left hand and place the black one, so the minus pole, in our right hand and use 0.1 to 0.2 milliamperes. In the fifth week, we want to stimulate and activate our bodies. Again, daily 20 to 60 minute session, plus pole in our left hand and the minus electrode in our right hand, 0.3 to 0.4 milliamperes. And then in week 6, we work on the blockages resolution and energize our body. Daily, again, 20 to 60 minute session, red electrode in our left hand and black one in our right hand, 0.3 to 0.4 milliamperes. And in the evening, we lower this to 0.03 to 0.05 milliamperes. Let's look at some common health conditions and how you can use the IONO-TRANS galvanic therapy device that you can get at vibrantbody.net, link in the description box below as mentioned, for that particular situation. Starting with bone and joint problems. For shoulder arthrosis, it is not only a pain therapy, but also can be a cure for arthrosis and rheumatism in the joints that is caused by acidosis and insulin resistance. How do we use the device? Well, we put a bent electrode, the plus pole, around the painful area, and also place a hand electrode that is also plus pole in our hand. And then we connect the negative poles to our feet. And we start with a galvanic therapy current daily of 0.4 to 0.5 milliamperes. We do this including the general galvanic treatment that I have shown you twice a week. For knee arthrosis, there are two protocols. Monday, Wednesday, Friday, we use one electrode, so the plus one on the painful inside of the knee, and we place the negative pole on the knees outside, and we repeat the session for 15 to 20 minutes on each knee with 0.2 to 0.3 milliampere, and alternate also the polarity of the electrodes. Tuesday and Thursday, we do hand-to-hand therapy with the plus electrode in the left hand and the minus electrode in the right hand to remove the acidic residues. The second and third week, we repeat the therapy and slightly increase the current intensity to 0.4 to 0.5 milliamperes. We wrap one bend electrode, the plus pole, above the knee joint and the minus pole below the knee, and treat daily for 30 to 120 minutes with 0.5 milliamperes, again for each knee individually. In the second and third week, we increase the current intensity that we use Monday, Wednesday and Friday to 4 and 50 milliamperes. And we massage with a positive electrode on the red one on the painful knee side. On the opposite side, we place the minus pole, and we alternatively can place the minus pole, so the black electrode, under the feet using a metallic water electrode in a bowl that is filled with water. And we apply 0.5 milliamperes for 10 minutes and increase the duration and intensity over time. Always, by the way, treat both knees. For trigeminous neuralgia, we use the massage roller electrode. We connect it to the positive pole and massage the painful face and skull zone. The black electrode goes on the tailbone, 2 fingers wide underneath your belly button. And we apply 0.3 milliamperes for 10 minutes each day and slowly increase the duration of the session and the current intensity. For spine therapy, on vertebra C7, we place the red large electrode, and on the tailbone, we place the minus pole, the black electrode, and apply 0.3 milliamperes for 15 minutes. You can also connect the massage roller to the positive pole and massage the whole spine during the therapy. Alternatively, you can take a galvanic bath with a plus in the same neck position and the black electrode in the water. For asthma, we use the large surface electrode with a plus pole being placed across the chest and a similar electrode with the minus pole being placed across the back. And we start with daily sessions of 5 minutes with 0.1 milliamperes and slowly increase to 0.2 milliamperes over 10 minutes. 3 times weekly, we also include general therapy, where we place the plus electrode on our neck or spine and the minus one on our tailbone. For diabetes, Diabetes 2 patients have a fully rigid cellular membrane due to acidosis in the whole body, and acidosis therapy concomitant with pancreas therapy is recommended and always brings release in those cases. Do not schedule this type of therapy in the evening. It may come to hypoglycemia at night, so careful. The best scenario is to have the treatment latest at 4 p.m. to observe and correct the insulin production and avoid your risk of hypoglycemia. Use the large size minus electrode on the stomach and the plus one on your back. And you also alternate plus and minus polarity in this case and treat with 0.5 milliamperes 3 times per week. And also you should include a general therapy once per week. For exhaustion, this therapy with galvanic currents must flow from the bottom to the top, meaning that you get the plus electrode on your feet and the neck or forehead, you have the negative electrode. And you have a therapy session of 20 minutes with 0.5 milliamperes and alternate with one available treatment hand-to-hand and hand-to-foot. For gallbladder problems, the large plus electrode is placed underneath the rib case and the minus electrode opposite on the backside above your tailbone, and the session is 15 to 60 minutes long with 0.4 milliamperes. For facial and trigeminous neuralgia, the red electrode is placed on the painful area and one neck electrode is flushing out a current, and the session takes 10 to 30 minutes. It should be performed daily with 0.2 milliamperes. As a sleep aid, daily in the morning we apply the red electrode on the left hand and the black on the right hand using the steel hand electrodes, 0.15 to 0.2 milliamperes for 20 minutes. Before we go to bed, we use the electrodes in the same configurations, but apply only 0.02 to 0.04 milliamperes for 20 minutes. For infectious diseases such as the cold, flu, throat soreness or coughing, we take the plus electrode and place it on the chest, and the minus electrode is placed on the back. We also take ferrum phosphoricum in D12 concentration. 10 pellets are recommended during this type of therapy to enhance our immune system. And we perform the session for 30 minutes at 0.3 milliamperes in the morning and evening. This type of therapy can also be used after surgeries or for wound infections. We take the plus electrode, so the red one, and place it close to the infection focus, and the black electrode, so the minus pole, is placed on the opposite side. For paralysis of the left or right arm due to a stroke, we can start working on the paralyzed limb only 4 weeks after the stroke, and the affected arm receives a stimulative black electrode, so the minus pole, and the hand gets the plus electrode. We treat daily for 10 to 30 minutes with 0.2 milliamperes, and we do this several times per day. For paralyzed legs, each foot is introduced into a bowl of water. For a left leg paralysis, in the water bowl with the left foot, we put the black electrode, so the minus pole, and into the other bowl we place the plus pole. For right leg paralysis, in the bowl with the right foot, we add the minus pole, and in the left-sided bowl, we put the plus pole, the red electrode. In both cases, we treat with 0.3 to 0.5 milliamperes for 15 to 40 minutes daily. For tinnitus, we take 2 ear electrodes, and the red, and we place the red ones, the plus poles, around our ears, and the minus pole is placed on our neck. The session takes 10 to 20 minutes with 0.2 milliamperes. For rheumatism and gout, we take the large size electrode. The plus pole is placed on the painful area, and the purge of pain is directed through the black electrode that is placed in the right hand or through the feet electrodes. Session time is 15 to 20 minutes with 0.5 milliamperes. And like gout, rheumatism is caused by acidosis and improper nutrition in many cases. The needle-shaped uric acids that form penetrate the joints and trigger the pain in this gout condition, and therefore it is recommended to change the food also, to take baking soda, and especially to alternate pain therapy of the affected areas with an anti-acidosis therapy. Acidosis can be treated daily for 20 minutes with 0.5 milliamperes. In this case, the hand and foot receives a large size plus electrode, and the purge is done through the black electrode that is placed on the painful area. Heart conditions can be treated in 3 different ways. A large gel electrode can be placed on a wetted felt and then applied to the heart region, where we connect the red pole. And the black electrode is connected to a large metallic feed electrode that is immersed in a bowl of water. And we apply 0.2 milliamperes for 3 to 5 minutes that way. The red electrode, as described, and a similar large surface electrode that is connected to the positive pole comes on the kidneys. And the minus pole is a large metallic feed electrode again that is placed in a bowl of water. And then we apply 0.2 milliamperes for 5 minutes with a large gel electrode on the heart zone, and a black electrode is held in the right hand. Again, we do this for 5 minutes and apply 0.2 milliamperes, 1 session daily for 3 weeks. For angina pectoris and arteriosclerosis, Dr. Holzer reports that 80% of angina pectoris patients were healed in his clinic and the rest improves significantly with galvanic therapy. The galvanic currents dilate the blood vessels, they chelate the arterial plaque, and also regulate nervous activity. And for this type of health condition, we take the red electrode and place it on the heart area, and the black one in the corresponding back area. For 3 to 7 minutes daily, we apply 0.1 to 0.2 milliamperes two times per week, and apply also one of the previous indications for general galvanic therapy. In our Western civilizations, every human suffers from arterial plaque of some kind and coronary vessel obstructions. And to assure a good functionality of the cardiovascular and the cerebrovascular system, we recommend galvanic therapy in conjunction with the regular intake of high dosage strophantine that you can obtain by contacting us at christine.doctor. Link is also in the description box below. For bronchitis, we place the large electrode on the sternum with a wet cloth underneath and connect the plus pole to it. And on the back side, we place another large electrode on a damp cloth and connect the minus pole to it. And we apply 0.5 milliamperes of galvanic current for 10 minutes. For neck and throat problems, we place the red gel electrode on the neck around the C7 vertebra, and minus pole, a metallic electrode in this case, in a foot bath where we add warm water, and we apply 0.3 milliamperes for 10 minutes. After that, we increase the duration of the session and the current intensity slowly. Eye conditions can be treated with different protocols. For example, between the eyes, we place the red electrode, and the black electrode, so the minus pole, is in the right hand, and we apply 0.2 milliamperes for 3 minutes. In the second protocol, same as the first one, only we inverse the position of the electrodes and apply 0.1 milliamperes for 2 minutes. For sinusitis, rhinitis, and migraines, the nose electrode, the plus pole, is placed on the nose or between the eyes, and we take the black electrode in the right hand. We use 0.2 milliamperes for 5 minutes. Alternatively, we can use the forehead, where we place again the red electrode, the bent electrode in this case, and connect the negative black electrode with the right hand or to the galvanic foot bath. And we apply 0.5 milliamperes for 10 minutes. Alternative red electrode can be placed also alternatively on the vertebra C7 and the black electrode on the tailbone. For ear problems and hearing problems, we take the gel electrode and connect it to the positive pole and place it behind the ear on the bone, and the negative electrode is in our right hand, 0.2 to 0.4 milliamperes for 8 to 10 minutes. For liver therapy, we take the large electrode, connect it to the positive pole, and place it on the abdominal right side underneath the right rib cage. And we put the black negative electrode above our tailbone. We apply 0.5 to 0.75 milliamperes for 10 minutes and increase the duration and current intensity slowly over a couple of weeks. Kidney therapy, place the large red electrode between your kidneys, and we add then the black electrode, a palm above the kidneys. Apply 0.5 milliamperes for 10 minutes, and we slowly increase the duration and current intensity over the weeks. And for stomach therapy, we place the large red electrode on the stomach area and take the black electrode in our right hand and apply 0.2 to 0.5 milliamperes for 10 minutes, and again slowly increase the duration of the session and the current intensity of weeks. Instead of using electrodes, all the different types that are available, we can also employ galvanic therapy in bath therapy. In galvanic bath therapy, our body cells can easily interchange ions, and thus our body's milieu can be nourished and cleansed better. As we have discussed, galvanic therapy, whether you apply it via electrodes or in this type of bath therapy, always improves your cellular membrane permeability and significantly increases thereby the transportation of nutrients to your cells and the excretion of metabolites from your cells. A healthy functioning cellular membrane should be around 80 to 90 millivolts, and this is what galvanic therapy can help you achieve. How do we employ this type of therapy in this bath situation? Well, the body is polarized using the black neck electrode, and the feet receive a red electrode that is immersed into the water. The neck must be outside of the water, and a sitting position is recommended while the body is immersed in the water up to the shoulders. Session time is 10 to 20 minutes with 0.5 milliamperes. And these are settings for a refreshing galvanic bath. It is preferable to take such a galvanic bath at latest by 5 p.m. The body position is the same as described above to relax and relieve stress. Still, the electrode placement is different. The feet receive the minus electrode and the neck gets the red electrode. Again, we treat with 0.5 milliamperes for 10 to 20 minutes. And this type of galvanic bath is recommended for good and restful sleep in the evening. For cells, galvanic bath can also be organized using the Vedget balance and for water metallic plate electrodes. Left hand plus right foot get the red ones, water electrodes in this case, and the hand, the proper hand and the left foot get a black electrode, again water electrodes. Therapy session of 20 minutes with 0.5 milliamperes, and each limb is immersed in a separate bowl that is filled with warm water. Time for conclusions then. What have we learned? Well, we've seen that life is an electrical phenomenon. All living beings work on an electrical level. They operate electrically. Just think of the neurons that are firing all the time to transfer information in your brain or your heart. TCM has considered for over 5,000 years already that diseases appear when the energy does not flow properly, when we have an energy blockage in our system. The cellular metabolism and inter as well as intracellular communication is mediated by electrical signals that are made possible through different electrolytic gates, the most important ones being the sodium-potassium and the calcium-magnesium pump. The interaction between the electrical currents and the cells are different depending on the kind of currents that we use. Galvanic current, that is similar to the battery-generated current, is the most beneficial for our cells. It restores the cellular polarity, increases the membrane potential, optimizes cellular metabolism, and some of the health benefits of galvanic therapy, as we have discussed, are that you can detoxify your whole body very efficiently and deeply. You can repair damaged tissues. It supports autoregulative processes, also neuronal activity. It optimizes your blood and cell regeneration capabilities, stimulates your hormonal and metabolic processes, improves capillary microcirculation, harmonizes body energy, balances your autonomous nervous system and central nervous system, removes energy blockages, regresses inflammations, stops infections, it acts antimicrobially, also energizes you and regenerates your whole body. And therefore, galvanic therapy is a true all-rounder that can be used for all known diseases, including cancer that we're gonna discuss in more detail in the second part of this presentation, MS, ALS, diabetes, rheumatism, you name it. Known and practically used since ancient times, galvanic therapies are being successfully used today as an electrocancer therapy in countries such as Germany, Austria, Italy, Spain, China, and Russia. And the significant advantages of galvanic therapy are that it's non-invasive, there is no risk of infections, it leaves no scars behind, you don't need any type of surgery or organ removal, it's completely pain-free with no side effects or risks, and efficient for many health conditions. It improves your whole body. No toxicity due to harmful drugs, chemo or radiation therapy necessary. We will further discuss galvanic therapy as a proven efficient method to treat cancer non-invasively in part 2 of this video series. So stay tuned, subscribe if you are not already, to not miss out on that. And with all that being said, I hope that you've enjoyed this presentation. If you did so, please support us directly by becoming a patron from as little as $5 per month. Link is in the description box below. For the holistic terrain therapy you need and deserve, please contact us at christine.doctor and check out some of the best galvanic therapy devices and other powerful holistic health tools at vibrantbody.net. Links are also in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to help the channel grow and spread the truth. Thank you very much for your attention, and until next time, stay healthy.